So we just wanted to go through some recommendations on writing letters of recommendation. So certainly for our residents coming up with fellowship applications soon, and then our medical students, we've got about 22 on the UNMC side and at least that many on the Creighton side that are starting to put their applications together for residency too. And so we'll likely be asking for letters soon if they haven't already asked you. So we just wanted to highlight two recent articles with tips. Nate, can you go to the next slide for me? First, why do letters matter? These are becoming even more and more important when it comes to residency selection, and that's because they can serve to highlight the intangibles that you can't really measure with grades or with step performance and those sorts of things. And so you can see there on the survey, they were very highly ranked as important when it comes to residency selection. The other thing that I want to point out here is in January of this upcoming year, step 1 will go to pass fail. And so if anything, letters of recommendation are going to become more important after that, as residency directors seek other ways to try to sort out the students and to try to do a more holistic review. Next slide. So what should you do if you've been asked to write a letter? The first is the preparation key. And so this can be a student meeting via Zoom or just collecting this data via emails too. And really you're using this to identify themes and kind of lay out your letter. And so things you want to get from the student: one, what are their goals, both in the immediate future with regards to residency programs, but also what they're thinking long-term. 2, what do they want to highlight about themselves? And getting their personal statement can help with this too, but looking at what they're highlighting from their clinical encounters, their service activities, their life experience. Along with that, we recommend you review the student's CV so that you can learn more about their experiences and accomplishments even outside of their time with you. And then after doing all this, if you do not think you can write a strong, fair, accurate, or timely letter, please tell the student. We would much rather you tell them that you can't write it and they look for other students than for them to get a bad letter. Next slide. So then once you start the actual writing component, they have this letter mnemonic, which can be helpful of things to think about. So first is length and location. In general, these should be 1 to 2 pages long. They've done studies among program directors of is a longer letter better, is a shorter better? And the short answer is it doesn't matter. Say what you need to say, try to be as concise as possible, but don't worry about how long it is, other than if it's a 1 paragraph, that might raise some red flags. The first part then usually that you want to start out with your letter is your location. And so this goes through your role and how you interacted with the student, where you work together, and if applicable, how much you work with other students and residents, so that the person reading your letter can gauge, do you think this student walks on water compared to 20 other students you've seen, or do you think they walk on water, but they're the only student you interacted with that year? Additionally with that, then that plays into experience a little bit too. And so with this, you want to highlight what the student's experience was. Things you could talk about as what patient load did they carry? What was their degree of autonomy? What were some of the clinical duties that they had during this rotation? And then also keep in mind highlighting interactions with interprofessional team members is important, as well as if they demonstrated sensitivity or responsiveness to diverse patient populations. We then move on to the first T. This is traits of the student. And so here you want to emphasize things that the student excels at. And this can be from the patient care category, communication skills, teamwork, self-directed learning. You can highlight medical knowledge too, but keep in mind that's something that they do get a little bit more information on too, at least from a test taking perspective with their other scores. One important thing to note here is if you only focus on non-clinical attributes, so just communication and teamwork, sometimes this can be construed that the student is lacking when it comes to the clinical performance. And so just trying to balance that as you can. Another important thing to note here is you really want to avoid commenting on personal appearance or English proficiency in this. The second T is tell a story. And so here is where if you can give a specific scenario where the student demonstrated some of those skills that you're highlighting, it's much more meaningful than just giving the generic statement that they're a hard worker or a good team player, but not giving any specific examples. And so trying to incorporate at least one example is important. E then is educational summary or their potential. So this is where you use their CV. You don't want to just regurgitate what's on that CV, but you want to instead highlight some specific contributions and kind of give your interpretation of how those reflect the impact the student's going to have on the patients or the profession as a whole, and how that student can uniquely contribute to the residency program or the future training program if it's a fellowship program. And then lastly, R is for recap. And so this is your bottom line. This is where you bring in your summary of what your recommendation for this student is. And Nate is going to talk a little bit about some buzzwords or different phrasings and how those are taken by program directors in a second. But in general, this is where you'd say, I gave my highest recommendation, or I would recruit this person to stay at our program. I hope they stay at our program, things like that. Nate?
Yeah, so as Alicia alluded to, we're going to talk a little bit about code words, so to speak, that in some ways may come across as benign, but may imply certain things about students depending on the verbiage and the words that we're choosing to use when writing a letter. And these things are taken from an article about 3 years ago that was a survey of pediatric program directors and really asking them their perspectives on letters of recommendation and how letters are written. So when you ask program directors in particular how positively or negatively they feel about certain phrases in relation to a student or an applicant in a letter, there's certain phrases that come across much more positively when used, and I think these top three stand out in particular. So certainly saying that you give your highest recommendation or that a student exceeded expectations speaks very highly and is definitely perceived by programs and program directors much more positively than other phrases. We often think that the second one from the top there is maybe the highest form of a compliment that you can give a student in a letter of recommendation. And that is to say that we want that student to stay at our own institution. And that phrase definitely stands out when we read that in letters of recommendation, because it's really a letter writer's way of saying that student performed so well that they're trying to recruit them to stay within their own residency program. And so I think it's a phrase or verbiage to keep in mind when writing a letter for those students that really do stand out, and this is what you're trying to relay to a program. As we go down the list, there are some of these phrases that, again, may seem relatively benign on the surface, but do have a certain connotation that will be relayed to programs. So for example, describing a student or an applicant as showing improvement, which in a lot of settings might be a good thing, but in the context of a letter of recommendation is generally perceived more negatively by programs and program directors than some of those phrases at the top. And then the same with that bottom phrase of a student performing at the expected level, which again, in some settings may be exactly what we're anticipating for a learner. But again, in the context of a letter of recommendation, it is implying that a learner or an applicant really was only performing at that kind of bare minimum level that you'd expect for where they are, not necessarily going above and beyond. And so these are just some phrases to keep in mind as you're composing a letter and really trying to use words and phrases that are going to convey to a program the things that you're trying to convey and how outstanding an applicant is for fellowship or residency. When looking at the features of a letter, then there are certain features or things within that letter that also program directors find more important than other things. And I think these top three stand out in particular. And Alicia touched on a couple of these already. So the depth of interaction with an applicant, and this is definitely important. This will stand out to programs. And, you know, if you are someone who worked with an applicant, you know, a week during their third year clerkship, and then a week during a sub-I, and then also did a research project with that student, that's a lot of time interacting with the student. That will speak volumes to a program, as opposed to, you know, I worked a couple days during their clerkship. The specific traits of an applicant and the applicant's abilities, this is getting into some of those details that Alicia touched on, where we're really trying to, by using different adjectives and words, describe, but also give examples as to how a student performed or you know, personified some of those traits. So not just saying they were hardworking, but how were they hardworking? You know, what did you observe while you were working with that student or that resident that kind of informed that the use of those words? And I know Dr. Bloom's on here, and she's going to touch on that here in a few minutes. There's some of these other things that are less important, and this is just looking at the percentage of program directors that find these things important. And Alicia touched on this as well, but the question often comes up of how long does a letter need to be? And what we find is that less than half of program directors find the length of a letter important, and in fact, less than a third find a long letter, or what they defined long as greater than 4 paragraphs, to be important. And so I think it's just to reinforce what Alicia pointed out of, take the space that you need. If you end up having to write a long letter to put everything on paper that you need to say in a descriptive way, great. If it takes 3 paragraphs to relay everything that you're trying to say about a student, that's also fine. I think the content of the letter and the way that you're describing things and again, communicating those intangible qualities about an applicant to a program, that's going to be the more important part. And then just as a word, since we are kind of in that season of both residents applying to fellowship and students that will be applying to residency, just some differences between how fellowship program directors versus residency PDs will look at the important pieces of a letter of recommendation. And there are a couple of differences, and some of these I think are intuitive based off of you know, what is more at stake or important during fellowship training as opposed to residency. And so, for example, participation in research, you know, 3 times as many fellowship program directors find that to be an important part of your letter of recommendation compared to what you might find in a residency or a student letter of recommendation. And the same is true of some of these other things, the involvement in program and hospital activities, the academic rank of your letter writer. And then slightly more fellowship program directors find a longer or more descriptive letter to be more important for fellowship letters of recommendation than for residency letters of recommendation. So just a couple of other things to keep in mind, just with the context of the letter, or the type of letter that you're writing, whether it's for someone who's applying to fellowship or someone who's applying to residency. And then Dr. Bloom was going to talk a little bit about abilities. Yeah.
And then one last slide briefly on kind of some of those specific applicant abilities, like the other two have already spoke about. As we work with all these med students throughout the years, we all see many of them who work very hard, they're trustworthy, they're very compassionate. As you can see here, this kind of goes through some of those buzzwords as well. That both the residency program directors and fellowship program directors find helpful. But I think that just kind of reinforcing what the others said, examples of any of those are always what we should be including in our letters. So we know that most of our med students are trustworthy and compassionate and professional, but those specific examples of when did they go above and beyond to sit with a family at the bedside, or, you know, really show these traits are what we should be highlighting in our letters of recommendation. Next slide, Nate. And then lastly, so after you've gone through all of the hard work of putting together these wonderful letters for our students, showcasing how great they've done with you, how do you finalize and submit this? So the med students will submit your name into ERIS, and as such, you will get an email notification and you can go through there to submit your letter for them. It's important that you include their AAMC identification number at the top of your letter. and to print these on professional letterhead so that they show that they're from our institution and look professional. Include your signature, your name, your title, and the date. And then we include a statement as to whether the student did or did not waive their right to see the letter. The majority of them will waive their right to see it. And then proofread, have your secretary proofread. If you haven't written very many of these, one of your partners or one of us or Cindy or Danny would love to help proofread these as well. They need to be uploaded in the PDF format. And then when you save it, it shouldn't have special characters in the file name. And then down here, I think, is a little screenshot of what that should look like specifically. Next, we have some fantastic coordinators which help us with the M4s and all of our educational programs. And so if you have specific questions, these 3 women have been fantastic resources for us as CST directors and would just be absolutely wonderful to help with any of the logistics in terms of uploading. If you're not quite sure how ARIS works, you haven't done this before, reach out to any of them. Also reach out to Nate, Alicia, or myself. We would be happy to help with any questions that you guys have. And Allison too, Allison Ashford, Dr. Ashford. And then we'll be sending out this PowerPoint and the articles which were referenced for you guys as well to use as resources as the time comes for you guys to start writing these and with any questions or concerns that you may have.